Welcome everyone to today's webinar. 2 years later, what one hospital on Cerner learned from automating intake, registration, authorizations, and more. On behalf of Becker's Healthcare, welcome and thank you so much for joining us. Before we begin, I'll walk through just a few quick housekeeping notes. If you have any questions for today's presenters throughout the webinar, you can type those into the Q&A box you see on your screen. If at any time you have trouble with the audio or video, please try refreshing your browser. You can also submit any technical questions you have into the Q&A box. We have a team on the line to help. With that, it is my pleasure to welcome today's presenters. We are joined by Kristen Guillaume and Dr. Todd Beardman. Thank you both for being here today. I'll turn the floor over to you.
Sure. Thank you very much. And thank you for having us. By way of introduction, as Sarah mentioned, I'm the CIO and marketing executive here at North Kansas City Hospital and Meritas Health. And with me, I'll let Dr. Beardman introduce himself.
Yep, I'm Todd Beardman. I'm the CMIO at North Kansas City Hospital and Meritas Health.
Thank you. And today we wanted to touch base with you on some progress that we've made with our partner Notable. Just from a consideration of who we are as an organization, North Kansas City Hospital and Meritas Health provides the largest network of provider practices in the Northland region of Kansas City, Missouri, with 550 physicians and 49 medical specialties. We serve the Northland region of the Kansas City, Missouri metropolitan area and beyond. As we look at our market broadly, we're not much different than other markets around the country. The healthcare ecosystem is changing very, very rapidly, with retailers coming into our space and mergers and acquisition activity presenting significant consolidation in our marketplace. So with regard to all of these disruptors, we really take a look at our consumer experience, our patient experience, and our overall digital strategy in terms of driving efficiencies, whether it be from an experience standpoint or a fiscal responsibility standpoint. In January of 21, most of us remember we had a pandemic that had descended upon us. For us, it became a perfect storm. We had been selected as a vaccination center for the state of Missouri. We were in the middle of transitioning EHRs to consolidate to one single platform for our health system. And we had the typical other challenges that you would see in a competitive marketplace. We had significant clinical and non-clinical staffing shortages and limited resources across the health system. Many of us, I know, were feeling that at the time. And for us, it seemed at some points in time untenable. But our first order of business was to focus on our community, as we always have, to ensure that we could address the needs of the community in terms of the vaccination opportunity that we've been presented with. So with that, we looked at the consideration and we looked at the platform and the tools that we had today and realized that we really needed to up our game in terms of what we could offer to the community from a vaccination standpoint and really beyond. With the advent of our consolidation of EHRs, we had looked at the entire digital experience of the consumer and of our staff, and we realized that accepting the status quo really wasn't an option for us. We had to try to look at these two opportunities from a strategic perspective and really look far ahead in terms of where the puck was going and not where we were at a certain point in time. And so with that, we initiated an evaluation of various different industry vendors in terms of who and what could address our needs to improve the patient experience, reduce staff burnout, improve financial performance, and improve care quality. So there were a number of different goals associated with what we were looking for, and we knew that choosing a point solution was probably not the answer for us, but we really didn't have a clear vision of what was out there in the market in terms of a platform. So we endeavored upon some early work with Notable that you'll hear about in just a moment. And it happened very, very quickly. And we had a full view of our roadmap, I would say, within 30 days of initiating discussions with Notable. As we look back over the course of the 2 years, the accomplishments that we've brought to the organization have been significant. They have required diligent focus from our team and an understanding of our processes, but we haven't let progress get in the way. We haven't let perfection get in the way of progress with regard to driving result in the organization, as we have seen that Notable is very nimble and agile, and we're able to work through opportunities or challenges that we have along the way. So at the outset of our conversations with Notable, we jointly set clear goals and measurements to ensure that we were measuring the impact of Notable over time. This was especially important to our CFO and CEO, and we established a governance process to monitor and measure our progress on a quarterly basis there. We still have that model in place today. We also created a very stringent, operationally sound plan and cadence for iterating on our progress as an organization and ensuring that we were scaling Notable, that we weren't just moving into pilot mode and getting stuck there for months and months at a time. Additionally, our commitment with Notable started very small, but again, moved very, very quickly. And we do leverage the full platform today, implementing the new capabilities that are available for us on probably every quarter, every 6-month basis. And we clearly prioritize those in concert with the organizational strategy and strategic plan to ensure that we're aligned from a priority standpoint. And now I will turn it over to Dr. Beardman to talk about the journey over the course of the past 2 years or so.
Yep, thanks, Kristen. So I have the easy part. I get to tell the story, and physicians are usually full of stories, so we'll get to share ours. The first time I saw what Notable had to offer, it was pretty exciting, and we weren't quite sure where we were going to go with it. And it was in the fall of 2020. If you remember that time, there was some excitement about COVID vaccines becoming available. We'd had such a rough 2020. And then, late November, early December, we got our hands on COVID vaccines, and we were vaccinating our staff. That was an effort that was very interesting and posed problems just with our own staff. And then, as Kristen mentioned, we were asked to be one of the high throughput vaccinators for the state of Missouri in our region. And we had been discussing with other healthcare systems, how they had accomplished standing up their vaccination clinics. There was a lot of concern around the scheduling process. If you remember, there were restrictions on who could get vaccinated first. There was a sequence that had to be leveraged. There were sign-up lists through county health departments, and we had some real concerns about our ability to handle inbound phone calls at the volume that we expected. We had some concerns about our patient portal handling the volume, and we'd heard some of those horror stories from other facilities. So when we were notified that we were going to be a high throughput vaccinator, we truly had 4 days to stand up the clinic. We were very fortunate that our EHR vendor, Cerner, is our neighbor, and we share a campus right next to Cerner. So they offered up space for us to provide the vaccination clinic. We partnered with another community hospital in our area, Liberty Hospital. We partnered with the cities and law enforcement, fire departments, and an army of volunteers to make this happen. But the core worry was, how do we get the patients in, and how do we get them signed up? So we turned to Notable, and they were very willing to jump in and help us. and very flexible in getting things stood up quickly. So within about a 7-day span, we were taking appointments through the Notable platform, booking them directly into our Cerner EHR. And it was incredible how quickly that happened. We were not accustomed to moving that quickly. So it was a great learning experience for us, what we can do in the face of adversity and how quickly we can get there. But I think the statistics towards the bottom of this slide are compelling. I just can't imagine that we could have handled 1,600 phone calls in the first minute that we opened up availability. And so using the Notable platform allowed us to handle that volume. So through the course of February through May, we vaccinated just under 100,000 patients in our area. And that experience with Notable really gave us the confidence that this is a platform that we could use in the rest of our health system. So from here, we talked about a contract with Notable in April of 21 to look at our ambulatory clinics, particularly in the registration space. When we started registration in April, our goal was that we would have a few clinics up within a month. And it turned out that we actually had all of our ambulatory clinics up within a month on kind of the base registration functionality. So that was really important to us, that speed to value. When we look at the other areas that we have deployed, we went from our base registration intake to clinical intake. So things like annual wellness visit forms for HRA, for depression screening, our standard MA nursing intake, as well as some, I call them HPI starters, but the initial chief complaint and a little bit more detail from the patient, as well as copayment collection and balance collection. Those were the kind of 4 areas that we initially tackled. And then we moved right into scheduling for our ambulatory practices. We had a previous vendor that we used in this space. It was not as seamless as this product has been. And we've had great uptake across not only primary care, but our specialties. Obviously, primary care is the primary usage location, but we do see our OB clinics, for example, have great uptake in online scheduling. One of the pieces that I was most excited about was looking at our population health offerings and how do we connect with patients about overdue exams, whether it be mammography or diabetic care, annual wellness visits, and being able to reach out through the platform. So we definitely tackled that early, and we stair-stepped a couple different endeavors, a couple different initiatives to get those different care gaps closed. And we can talk a little bit more about that as we go. More recently, we have been looking at prior auth and how we can automate some of that repetitive work that goes through the payer portals. And we stood up a pilot initially, and we are right now on the cusp of going live with kind of the full platform around prior auth. So more to come on that. And then finally, a more recent event is our digital assistant that is on our website, uses generative AI to respond to patient questions. That went live a few months ago, and we're continuing to work with Notable and refining that, and it's been a good experience for us so far. One of the things that Kristen alluded to is that we are a single hospital health system. We oftentimes don't have the same economy of scale that a large multi-hospital health system will have, and so we often find ourselves doing more with less. In that vein, we talked about the patient experience and what can we deliver without breaking the bank. And so we didn't have a lot in terms of digital outreach to patients prior to Notable, but installing that base platform allowed us to really do that pre-visit registration, allowed us to do the copay collection and balance collection, as well as the clinical intake. And so I think that experience for our patients has been a real win. As you think about your expectation as a patient, it shouldn't even be a question, right? You would expect that if I can order from a department store and pick it up in the parking lot, that I should be able to do something similar in healthcare. I should be able to book my appointment, fill out my forms. It's just an expectation of how healthcare systems have to operate today. And to be perfectly honest, we were behind when we started down this road. And I think this has allowed us to catch up pretty significantly. So improving the patient experience obviously was a big goal of ours. And you can see the screenshots of how our system functions. And it's very intuitive and easy for patients to understand. The other area that we were concerned about was, how would patients react to this? We weren't sure. We thought it would be a positive, but as we looked at the statistics, we saw that 97% of our patients really enjoyed this experience and had a positive reaction. And this has been consistent since we started. Sometimes it goes up as high as 99%. And our staff have also expressed that it really makes it easy when checking in patients. And so the patient experience was a big part, but we knew we also had this huge burnout happening through the pandemic with our staff. We were short on staff and they were working really hard. So as part of this, we looked at what can we do to help them? What can we do to help our clinic staff, whether it be the front desk, the MAs or the nurses, our providers, our billers? How can we make each level of that interaction work better? And so that's why we tried to be selective in the areas that we implemented and eliminate some of the waste that was already happening with the manual processes that we had. As we looked at our success in that area, we did see that the staff were more refreshed in some cases. They were being able to accomplish other tasks. And when the patient has completed the process, it truly is a great experience. It becomes more of a human interaction, a personal interaction, rather than a financial or clinical transaction. And I think that's the win for our staff too. They don't want to ask everybody for their card. They want to ask how they're doing. And so I think this allows them to do that. The other couple goals that we had were financial performance. Kristen mentioned that. Obviously, the pandemic was a difficult time for everyone financially. And one of the ways that we thought we could make a difference was in our no-show rates. We weren't sure if we would get higher copay or balance collection, but we had a feeling that we might have better no-show rates. So when we looked at that, we saw a 34% reduction in our no-show rates, which honestly, in the first year, paid for the platform. And that was the win, the easy win for us. What we didn't fully expect and what we did see was that the copay and balance collection was also a win. It took longer for us to realize that, but it actually has been an eye-opening experience to see that patients are paying the full balance when it's due. And I never expected that. I'm not sure I would do that as a patient. Maybe I'm jaded physician in that respect, but patients are doing it and they're taking care of it, which is amazing to see that it really is just showing them, here's what's due, here's your copay, and they're paying it. So it's been an important step for us in improving that financial performance. And then lastly, and again, probably my area that I'm more excited about than anything is the care outcomes. And that's really what we're after here. The rest is operational efficiency, improving the patient experience, improving the staff experience, improving the financial goals. But the outcomes are what matter to me. This is how we take care of our patients. I come here as a patient. My family comes here as a patient. We want to have the best outcomes. And how can we help our clinicians provide a safety net for those that aren't getting those important tests done? So we really use the tool as that safety net. We expect our providers are going to ask you, have you had your annual wellness visit? Have you had your colonoscopy? But when it comes right down to it, we know that there are patients that don't get them done and maybe aren't in front of our providers. So how can we engage them? This platform allows us to do that. We send these on a monthly basis. We do restrict it so that a single patient doesn't receive the same outreach more than once every 6 months. But we find that we get care gap closure at about a 16% rate. And you think that that's fairly low, and I would agree with you, but we do it every month. So we're getting 16% every month. And over time, we've found that that really makes a difference in our quality metrics. So as a health system, we're seeing that very broad impact on our care gaps. But on a personal level, when you think about, again, as I mentioned, my family goes here and my family gets their care here. What can we do at the individual patient level that's really going to make a difference in their lives? So I was very interested in this when we started, particularly around mammography, just since the prevalence of breast cancer is so high. In that first year, there was a lot of tracking that was going on. What's happening with these patients? How many got their mammogram? How many had a biopsy? How many actually had biopsy-proven cancer? And in that first year of outreach, we saw 6 women who were diagnosed with breast cancer, and they were diagnosed because we provided outreach to them. All of those 6 women had early cancer and were treatable. And I think that's the personal touch, that's the personal win where we can make a difference in our community. So that's something that we really keep in our minds as we look at other adventures that we want to go on with Notable. What impact can we make? And is it an impact of efficiency? Is it an impact of outcomes? We want to tackle all of those. And this is a way, a platform that allows us to do that. So thinking about the performance, and these graphs are a mid-year performance. So comparing the 2022 to 2023 calendar years. And we were not doing significant care gap outreach in 22. We had started a little bit, but it wasn't fully in process. But we saw uptick in every quality measure year over year at the midpoint of the performance year by using Notable. Now, could other things have been at play? Absolutely. Did we have a focus on pop health in our health system? We did. But I do think that these outreaches made a difference in boosting our performance. So we saw it in annual wellness visit. We saw it in hypertension control. We saw it in our diabetic population. We saw it in our breast cancer population. The one area that did not have a significant boost was colorectal cancer screening. And I personally think that the biggest culprit there is accessibility. We just can't get access to get colonoscopies done because of the backlog from the pandemic. A lot more people are getting FIT tests, which is great, but we didn't see a statistically significant bump in our outcomes on colorectal cancer screening between 22 and 23, kind of at that mid-performance year. So overall, definitely a win for us in the pop health space. I do think that as we look back over these 2 years and think about, did we accomplish what we set out to do around patient experience, around staff burnout, around our financial performance and our quality, our outcomes? I do think that we had a positive impact in all 4 of those categories. Is there more to do? Absolutely. And that's why we continue to work with the Notable team on areas that are pain points for us. And probably the biggest win from my standpoint is what Kristen alluded to around wanting a platform. We wanted a platform that had a lot of capabilities, and it allows us to be creative and solve problems within our health system that arise. And that has happened over the last couple of years, and we've used Notable to help solve problems, whether it be vaccination or our infusion clinic or different things that come up that we need a digital platform like Notable. So those are my comments. And Kristen, I don't know if you want to chime in on our goals and kind of where we've been, but certainly been a positive for us.
Sure, I'll just chime in briefly and just note that as Dr. Beardman was closing there, he highlighted a few different areas of focus that weren't mentioned as primary goals for us, but we have adapted the platform for many other use cases across the health system, sort of on a emergent or on-demand basis. And those are smaller initiatives that usually take a few weeks for us to ramp up and roll out, but they have provided significant value as well. And then I would also want to highlight the fact that the use cases are long, and it's amazing from an organizational perspective how many new ideas come forward, where people are asking and requesting for priority in terms of, could we solve the problem with this? Could we solve the problem for that? Specifically, one area that has benefited the organization greatly is with our PT focus, whereby the patient will want to schedule 6 to 8 to 10 visits at one time. And if they need to cancel or reschedule 1 or 3 or whatnot, they're able to very easily do that through the platform. And that has saved our staff, from the PT standpoint, OT and speech therapy, a lot of time and a lot of engagement and frustration with the patient. And it makes the patient very, very happy. Another area to mention and highlight is just that we have deployed this well beyond the clinics into our outpatient areas. And that was a very significant demand as well, and a much more significant level of complexity, I would add as well. So the use cases are nearly endless, and your staff and your team will initiate those and discover those as they see the platform in motion.
Great. Well, thank you so much, Kristen and Dr. Beardman, for those insights. We have time for a few audience questions today. So the first one here is, I believe, for you, Dr. Beardman. This audience member asked, we are also on Cerner. How well does Notable integrate?
Yeah, so actually very well. We primarily use the Ignite API FHIR interface that is available through Cerner. So anything that we can route through that API, that's our preferred method. But for things that cannot go through that API, Notable uses RPA, or robotic process automation, that can mimic what a human does. So for example, power forms in the Cerner platform. When we do our clinical intake for our nurses and MAs, we use RPA technology to fill out those power forms, put them in a saved state, and then the clinician can come by, review it, and sign it. So the integration is actually really good. Do I want more? Of course. There's always areas that we'd love to see more APIs available. The APIs are certainly faster. They're nearly immediate, whereas RPA takes, maybe 5 to 10 minutes for the bot to do the job and fill out the power form or whatever else the task is at hand here.
Great. Thank you for that. The next audience question is, where do you recommend other independent hospitals start on their automation journeys?
Yeah, it's a difficult question. I can tell you that I don't think there's a right answer. I think the right answer is wherever your pain point is. For us, our pain point was our front desk in our ambulatory clinics. And so that was an area that we were very focused on, trying to get our patients from the front desk into the back part of the clinic to get their visit underway. I know that others have started in the prior auth space. Some have started in urgent care. So I don't know that there's a right answer, but I will say that the standardization in the area that you tackle is really important. We were fortunate that we'd just gone through an EMR change in our ambulatory clinics. And so we had standardized a lot of things. Schedule templates, we'd standardize forms, whether they be intake forms or other clinical forms. Wherever you choose to start, think about how you can standardize that area first, and then jump in with both feet and just move quickly and iterate. I think that's the lesson we learned. And I will tell you, we were not accustomed to iterating as quickly as Notable does. And so it took us a while to get our footing and get comfortable with that pace. But now we expect it. We expect that pace. And so I think that's an important lesson. If you're used to longer projects that run for 12 months or 18 months, you're going to be moving much quicker. So I think that's another thing to be aware of.
Thank you, Dr. Beardman. I think we have time for one more question here. So, how did you convince your doctors to open up their schedules? Did you do any standardization, like appointment templates ahead of time?
We did. So, kind of as we were discussing before, the schedule templates were a big deal, and we reduced our appointment types that were available. We standardized, especially primary care, their schedule templates. There are some variants, but in general, they're fairly standard. To be perfectly honest, it didn't take a lot of convincing for primary care to open up their schedule. Specialists, it takes a lot more convincing, and a lot of it has to do with new patients. We don't really allow new patients to go to the cardiologist, for example, just from the website. We know that we need a referral. We know that we want to ask some questions about the acuity of their illness. Are they having active chest pain right now? I don't want them booking an appointment 3 months from now if that's the case. So there are certain areas where it takes a little bit more effort to talk to those docs, but primary care should be, in my opinion, it should be wide open. And if it's not today, it's worth the conversation to meet with your docs.
Fantastic. Thank you so much, Dr. Beardman and Kristen, for sharing your time and insights today. I would also like to thank Notable for sponsoring today's content. To our audience members, thank you for joining us. We would really appreciate it if you could take a moment to fill out the post-webinar survey you see on your screen. We hope you have a wonderful day.